Repair spiegelian hernia. The physician makes an incision over the hernia. The hernia sac and facial defect are identified and dissected from surrounding structures. The hernia is reduced and the hernia sac may be resected. The hernia defect is closed with a prosthetic patch or by plicating layers of muscle and fascia over the defect with sutures. The incision is closed. Repair, diaphragmatic hernia, other than neonatal, traumatic, acute, chronic. The physician makes an incision in the chest or abdomen. The abdominal contents are drawn back into the abdomen, and the hole in the diaphragm is exposed. The opening is closed with sutures or by insertion of a patch. The tear is repaired with non-absorbable sutures. The incision is closed with sutures or staples. Repair epigastric hernia, e.g. preperitoneal fat, reducible. The physician repairs an epigastric hernia. The physician makes an incision over the hernia. The hernia sac is identified and dissected from surrounding structures. The facial defect is identified circumferentially. The hernia is reduced and the hernia sac may be resected. The hernia defect is closed with sutures. The incision is closed. Repair inguinal hernia, sliding, any age. The physician makes a groin incision. The hernia sac is identified and dissected from surrounding structures. The hernia sac is opened and the abdominal viscera attached to the sac are dissected away from the sac if possible. The hernia contents are reduced and the hernia sac is closed and a portion of the sac may be resected. The incision is closed. Repair lumbar hernia. The physician makes an incision posteriorly over the hernia. The hernia sac is identified and dissected from surrounding structures to expose the facial defect. The hernia is reduced and the hernia sac may be resected. The facial defect is closed with sutures. The incision is closed. Repair lung hernia through chest wall. The physician makes an incision through the skin overlying the defect and carries the incision down to the inside lining of the chest cavity. The defect is repaired by the folding and suturing of tissues or the rotation of muscle and / or thick fibrous tissue flaps over the area and suturing of the flap over the defect. Alternately, the defect can be covered by a synthetic mesh material which is sutured in place. The incision is closed in layers of sutures.